So this plasticity changes that we were talking about at the synapses is going to lead to changes within the overall function and functional anatomy of the system, where within the cerebral cortex, we're going to undergo invaginations of neurons based off of the density of connections and the weight or mass of the cells based off of the hypertrophication that takes place and atrophication that takes place due to use and disuse. We're going to be generating stronger synapses or weaker synapses within networks. As synapses become too weak, we actually will prune away those neuronal connections. If there's excessive amounts of pruning that will take place, the neurons themselves are lost. And each time we change the connected points between the neurons, we start seeing greater degrees of invaginations within the cerebral cortex. And so when we look at it, it goes back to what we saw earlier in terms of what happens to the neuron as we start getting more and more and more connections. And so the more connections we get, the more robust the neuron becomes. That robust neuron becomes denser than the other neurons around it. And that's what causes the invaginations that we see in the cerebral cortex. This change leads to the greater girths of the gyruses and larger amounts of axonal connection points between the various structures of the cerebral cortex, and it leads to the foldings that we see within the cerebral cortex itself, where the foldings have to deal with the changes of density within each of the stratas of the cortex within the cortical layers of the cortex and the tension lines that exist along the axons, where we will see these axonal projections holding the sulcus and the gyres in place based off of the change of densities and the lines of tension and compression, where we need to keep the axons intact, and the connective tissue surrounding the axons will act as guide wires, allowing for the sulcus and the gyres to form, where the more the cerebral cortex is used, the larger these gyres happen to be, and the more narrow. In terms of aging, what we have to remember is a couple of things, and we'll talk about this a little bit more in detail when we look at how activity is going to impact cognition and cognitive abilities. But as we age, there's a natural loss of neurons and neuronal activity that takes place. Some of this decay is going to lead to decay in other systems and can lead to homeostatic dysregulation that usually is seen with normal aging processes. The initial noted decline is usually in motor coordination, followed by memory functions, and the loss in both motor as well as memory is based off of the use that we get from those systems. The more we use the neurons, the more synchronous they're going to be. The more synchronous they're going to be, the more robust they are, and the less atrophication that takes place, meaning that we're going to see a slower decline in the cerebral cortex that is highly active, as well as the person who is excessively active. In this, there's a high correlation of reduction of function with changes of cardiovascular function and aerobic fitness. There is about a 5% reduction in synaptic transmission rates by around 50 years of age, where at 70 years of age, the transmission of action potentials is about 90% of maximal transmission rate, and we get a slow decay from that point. At about 70 years of age, we start noticing reductions in gyral girth and expansions of sulcus widths. The rate at which those changes take place is going to be based off of the rate of use of the cerebral cortex, followed by the level of physical activity of the individual. The rationale for these losses is dealing with the aerobic obligated nature of the tissue, where we start to lose mitochondria, we start to lose new mitochondria forming, and we start losing mitochondrial enzymes. This leads to a reduction in aerobic efficiency of the neurons, an accumulation of ROSs, reactive oxidative species, and inflammatory proteins within the neurons and surrounding the neurons, which leads to a modification of membrane stability and the inability to transmit signals from neuron to neuron. The ability to transmit neuron to neuron is based off of, is the synapse clean or not? And part of what happens is that as we age, we start to accumulate denatured proteins within and around the axons and around the synapses, which reduces the functionality of the neurons itself. Additionally, with poor aerobic fitness and high amounts of stress, we get reduced sprouting signals even if the person is cognitively active, and we get poor maintenance of what is there at the first place. And so how does this all lay out? And let's look at it as it relates to one of the more common neurodegenerative diseases, Alzheimer's, where as we start having increases of stress, we get stress hormones, and we get accumulations of ROSs and atherosclerosis. This leads to increased inflammation, increased ROS accumulation, reduced vascular flow, and increase of tau and amyloid plaque accumulations. With more stress, we get a reduction of synaptogenesis, which means we block synaptogenesis, we block neurogenesis, and we block plasticity from occurring, which also will induce increased Alzheimer's risks. We can flip this a little bit by being physically active. By being physically active, we reduce the stress responses and we start to have what's referred to as an anti-inflammatory response. And we start to induce neural growth factors. We also will induce epithelial growth factors and the collateralization signals leading to new and more blood vessels. As we have lower inflammation and greater growth factoring, we start to increase synaptogenesis, we start to increase neurogenesis, and we start to increase the plastic responses and the survivability of the neurons that are there, thereby blocking the Alzheimer's risks. In a counterbalancing effect in between physical activity and normal physiological stresses that take place with aging. Now notice there's nothing in here about being cognitively active, it's about being physically active. And one of the things that we have found over the last decade or so is that it's more about being physically active than it is about being cognitively active as it relates to loss of neurons and the issues of dementia and poor motor coordination that we see with aged individuals or people with neurodegenerative diseases. Now, there's another side to this plastic change that takes place with aging, and it's within the spinal cord and the peripheral nerves, where we have highly plastic networks within the early phases of life. Early in life, we are establishing the neuronal networks and we are allowing for hypertrophication of axons and myelination of those hypertrophied axons, where we're able to get down patterned movements. The patterned movements lead to centrally pattern generated actions or stereotypic movements. This leads to the ability to cross-link between stereotypic movements and increase the complexity of movement that we have. We're also able to refine that movement through reverberating and parallel pathways so that we're able to get the correct pattern of motion that we want. We can increase the dexterity of motions that we have based off refining these movements and refining the coding of these signals. This change in plasticity that exists early in life, we can refine as we move through adulthood and maintain as we move through adulthood, as long as we continue to use those patterns. This is what leads to what everybody refers to as muscle memory. But it's not really the muscles remembering, it's the spinal cord and the motor pathways remembering how did I lay down the initial pattern of motion necessary to do what I need to do. As we age, we start to lose the functionality of the peripheral nerves and the peripheral neurons and the peripheral receptors, either through metabolic changes within the neurons or due to desensitization processes at the receptors, due to lifetime overexposure to modalities and submodalities within the receptor itself. This leads to a decrease in responsiveness and a decrease in synaptic activity. This decrease in responsiveness and decrease in synaptic activity leads to a loss of motor function, a reduction in reflexive and reactive behaviors. It leads to a weakening of synapses and a reduced metabolic activity within the neurons, leading to a continual progressive downward trend. We become more reliant on slow axonal transmissions, which means that if damage occurs, the rate at which the axon repairs is much slower and takes a longer period of time. We can also start to lose some myelination within the axons based off of Schwann cell reductions. And steep the sulcus are, whereas the less the cerebral cortex is used, the narrower the gyrus become, the less robust the gyrus, and the broader the sulcus is. And so one of the things we can see with aged brains is this very broad sulcus, whereas with very young and active brains, we see this very broad gyrus.